Welcome to the Plastic Surgery Channel Round Table. I'm Dr. Bruce Van Atta. With me today are three esteemed colleagues, Dr. Ned Snyder, Dr. Stephen Camp, and Dr. John Cook, and we're going to discuss jaw lines today. So, gentlemen, I'm interested. What are you finding patients, particularly younger patients, are they focusing a little bit more on their jaw lines? Ned?
Well, absolutely. I think that if you look 10 years ago, I don't think that I saw people in their late 30s, early 40s come in and asking and talking about what was the very earliest signs of jowling. So absolutely, I think that it is definitely something that's concerning younger people than it used to.
So, Stephen, what kind of things would you offer these patients?
I mean, I think classically surgical chin implants have been a mainstay, but now more and more we're seeing young patients focus on trend on that sharpness of the neckline and really defining the edge of what they call their jawline. And so there's some techniques with fillers and Botox that certainly lend themselves well to that.
Sure. John, how about you?
Well, it's always about making an accurate diagnosis. So if you have an early loss of tone on the jaw, we'll often use external radiofrequency. If you're in kind of the middle of the ground, then we might use kind of a hybrid technique where we just do a minimally invasive. But there's no substitute. Once it's gotten to a certain point, a neck and jaw border lift is the way to go.
Sure.
Because you're working in 3 dimensions.
Right, right. So the radiofrequency, though, that's a minimally invasive technique
Exactly,
versus open surgery.
Precisely. You can make tiny little openings and come in that way. And then, of course, the external radiofrequency is totally non-invasive, but you've got to select the patients. If you try to use one of these lesser techniques on somebody who's got a real problem, it's not going to work.
Sure. So you think this interest, is this coming from social media, people talking about it, or selfies? Or what?
It's absolutely that. It's modern technology. It's selfies. It's people taking pictures of themselves and posting close-ups of themselves on social media, and they're paying closer attention to themselves and their own defects, if you want to call that. But it's just aging.
Sure, sure. But I think people are maybe a little more aware of anatomy now, huh?
That's right.
Yeah. Yeah.
I think there's that, and they're capturing themselves in everyday activities which aren't necessarily flattering. Even a couple years ago, there was a term I kept hearing, tech neck, where patients would look down at their phones to read something and catch themselves on a view, a reverse view. And it's the most unflattering visual you can have of yourself, and it's not realistic. So we always have to kind of refocus our patients, make sure that they're grounded in what they're seeing.
Sure. Well, and John, as you pointed out, we have a lot of tools in our toolbox today to take care of these patients.
We certainly do, and that's all for the best.
Right.
You just have to use them wisely, and if you use the right tool on the right patient, then you get the right result.
There you go. That's always the case. Well, that'll wrap it up for this Plastic Surgery Channel Roundtable. Thanks.